There is a saying that cuts across cultures, but the Hausas used to say, "Rigakafi yafi magani," which simply means prevention is better than cure. And honestly, that's one truth that never gets old. When you think about it, good health isn't just about not being sick. It's about being protected even before sickness comes peeping in. And that's exactly what vaccines do. They quietly provide a shield against unwanted intruders into our body long before we realize we need to go to the hospital. And that's why on Health Options today, we will be talking about that silent shield, the life-saving power of vaccines, especially the double-barrel vaccines against two most deadly killer diseases, measles and rubella vaccine. Babandaro in Hausa, Ita in Yoruba, and Akpata in Igbo. On today's episode, we'll get to know how one tiny jab can make the difference between life and death, between hope and heartbreak for families. And there is always something to look forward to on our Nature's Corner. I am Salwa Khalil Ibrahim. It's a pleasure to have you join me. For decades, vaccines have quietly been saving lives. From measles to polio, human papilloma virus and neglected tropical diseases to yellow fever and COVID-19. Vaccines help to train our immune system to recognize danger and fight back even before an infection takes grip. It's like having invisible armor inside your system that protects you without you even realizing it. You know, our parents used to think that any rash that comes with fever was simply measles or bakwandaro, as my people call it. Whatever you call it, we have all heard stories of how serious it can get. It will cause blindness, hearing problems, even death in children. But the good news is that it can be prevented with a simple jab or sometimes an oral drop. Can make all the difference. But have you heard about rubella? Some call it German measles. And did you know that both measles and rubella can be prevented together with one vaccine? The measles rubella vaccine, yes. Stay with us as we unpack everything you need to know about it, how it works, why it matters, and how it's helping protect millions of Nigerian children. Joining me in the studio is a Principal Medical Officer in the Department of Disease Control and Immunization of the National Primary Healthcare Development Agency, NPHCDA, Dr. Garba Bello-Bakunawa. It's good to see you again and welcome to Health Options, Doctor.
Yeah, thank you, Salah, for having me.
Now, let's start with the basics. What is the real difference between rubella and the measles most of us are familiar with?
So, thank you very much. Measles and rubella, they are very, very similar. Usually, they manifest with rash, cough, symptoms that just similar to like upper respiratory tract infection. The most important difference is like beyond affecting also children, especially under the age of 5 group. So, rubella also affect pregnant mothers. So therefore, it manifests with other additional symptoms that are more critical, that are referred to as like congenital anomalies.
Yeah.
So a syndrome that we refer to as like congenital rubella syndrome. So this is very rare, but it's actually one of the main reasons why the government of Nigeria is also focusing to ensure that we have this vaccine into the system.
Okay, before we get there, now you just told us that it can be passed from the mother to the baby during pregnancy. Yeah. Just how infectious is it?
Yeah, so it is actually contagious just like measles, especially when a woman also get infected, and if that woman is not really protected from rubella, so it can actually pass from the mother to child. The child manifests with some features that are like appearing to be like Down syndromes and other features that the child is not really like a very normal child. In terms of the intelligence and others, you see like that child will not really manifest like other children. Then it may also come with some other manifestation that has to do with the rashes in the throat, and all those ones are really very, very critical. Unlike measles that usually manifests with coughs and some couplet, what we refer to as couplet spots. So for this one now, usually you see the rashes in the case of rubella. They appear in the faces and also on the trunk. And usually those are very, very difficult even to differentiate from that of measles. The most critical one is to ensure that at least all the women are also protected. That is why we are also targeting up to like age of 12. So when they have the vaccine, they will really develop those antibodies, and those antibodies will really be there to protect the unborn child.
Okay. Now, in terms of your target now, report shows that about 75% of children who get measles never receive a single vaccine dose. Is that, why do we still have that kind of gap?
There are a lot of challenges around the vaccination. So, and of course, you know, Nigeria is a very dynamic country, and we have the population is mass. So even though the routine system has been trying actually to reach all the children, but still we have quite a number of children that are missed. And at the same time also we have other challenges also in the community and in our state. You see, we have insecurity, we have areas that are hard to reach. So our vaccinators really try as much as they can to really reach those children, but still we have quite a number of those children that are unreached. But in terms of the performance of the program, actually we are making progress to ensure that at least we reach all those children.
Okay, like the challenges you mentioned, could that be in terms of lack of awareness, or just people don't want to take it?
No, actually it's a multifaceted. Okay. So first of all, we have a very heterogeneous society, as you can also agree. So, and at the same time also, we have people that are really living in some very hard to reach areas, very difficult also to reach. So we have awareness into the program, because part of what we really provide is actually to ensure that during the vaccination period also we provide health talk. And at the same time, we also work with media like you to ensure that we pass those messages also to the population that we have those vaccines available. But despite the fact of that, you know, Nigeria is vast. So still those information didn't really reach those population. Through the program, we also reach out to the community leaders, religious leaders. At the same time also, that's the traditional rulers. So the idea is to pass those information through them, and also so that they can pass it, because the traditional leadership also, they have their own link, and they have their own means of communication. So, and at the same time also, we have what we refer to as vaccine hesitant group. Those vaccine hesitant group also, they play an important role around ensuring that also they like counteract some of the messages we give. So they move ahead to pass some false information that are really misleading. So though people in the community get the information about the vaccine, but in terms of acceptance of the vaccine, we have also some gaps. So that is why also in the program we have risk communication group, and we have a lot of partners that we are working. So, and those partners, their main role is to ensure that at least they counteract and also they debunk the rumors. Okay, so those are some of the challenges. Those are some of the challenges that we have. Okay.
Now, among all the routine vaccines, why the renewed focus on rubella at this time?
So, just like to also clarify further, so like this vaccination campaign that we are calling it like integrated like campaign. Why we call it integrated campaign is for the fact that it's not only measles and rubella, but the focus is because we are leveraging the opportunity of the rubella measles switch. That is why we are now making a lot of noise calling measles and also calling rubella. And for the fact also, rubella is coming for the first time into the routine system. Before we use only measles alone vaccine. But now we are adding rubella, which is referred to as like German measles. It's just very similar to measles that we have. So the idea we are now using that opportunity to ensure also we leverage on that platform of the campaign to deliver other intervention beyond immunization alone. So we are delivering the entire package of vaccination in the country, and this is one of the very important intervention that is targeting a very large number of population in the country. So beyond measles, rubella, we have also routine immunization vaccine. Okay. And the routine immunization vaccine actually is a spectrum of a lot of vaccines that cut across major deadly killers of children, those diseases that are also all vaccine preventable.
Okay, so it's now an opportunity for those who have missed a dose to now to get vaccinated against all other diseases. Now, let's pause here for a short break. We'll be back shortly. Stay with us.
Kuka, that's the name in Hausa.
That is call it Oshe.
In Yoruba.
Oshe, Igi Oshe.
Okay, so I know it's Kuka.
I am delighted to have you join us on Health Options, the program that not only tracks government policies on health.
The total cholesterol is made up of some components. The high density lipoprotein, which is the good cholesterol, the low density hypoprotein, which is the bad.
Cervical cancer, a type of cancer that develops in a woman's cervix.
There were opportunities for women to get screened for both cervical and breast cancer, maybe up to 30,000, but we'll be having figures of 5,000.
Welcome back. Well, if you just tune in, this is Health Options at the NTA. We have been talking about the life-saving power of the measles rubella vaccine with my guest, Dr. Garba Bello-Bakunawa. Many thanks for being here, Doctor.
Thank you, and thanks for having me again.
Okay. Yeah. Now, let's continue with the conversation. Now, how important are vaccines generally, and where would you say Nigeria stand today in terms of acceptance and coverage?
So, thank you very much. Measles, rubella as the major target, but generally, vaccines are the most cost-effective public health intervention that we have globally now. So you can also look at a vaccine is targeting some of those very important deadly diseases. You can name it. Those diseases that really cause deformity, affect families, cause a lot of economic hardship, and at the same time also affect the productivity of the country. So vaccine generally are referred to as the most cost-effective public health intervention. And as a country, Nigeria, we are not left behind in terms of providing those very important interventions. Presently, where we are in terms of the administrative performance of the coverage, we are about like 70%. However, if we can look at also the survey, we are a little bit behind, but the country is really making a lot of progress. So presently, we are really making a lot of progress. You may recall that recently Nigeria also led in terms of the human papilloma virus vaccines. In human papilloma virus vaccine, which is for cervical cancer elimination, we vaccinated over 12 million girls, and it was recorded as one of the best and the most very effective and successful vaccination campaign that was recorded.
In not leaving any child behind, like you mentioned, at what age should children receive the measles rubella vaccine according to Nigeria's immunization schedule?
So according to the Nigerian immunization schedules, a child from the age of 9 months, so that is for the routine system. Okay. So, but in terms of this campaign that we are doing, we refer to it as a catch-up campaign. What it means as a catch-up campaign, if you look at it, this vaccine, just like we have mentioned earlier, is an opportunity for those that didn't receive measles before to get it. And it's an opportunity for those that also pass the age of routine immunization vaccine, which is between 0 to 23 months, to also ensure that they get the rubella. So that is why we extended this campaign between the age of 9 months up to 14 years. So this current vaccine is targeting the age group between the age of 9 months up to 14 years. And this is why we have a very large cohort that we are targeting for this particular vaccine. And it's across all the 36 states and FCT.
Okay. Now, how and where can mothers access this vaccine, and what advantages does it offer?
So thank you very much. It has, let me start with the advantage. It has a potential to really prevent our children from having measles. You may recall that measles is one of the commonest vaccine preventable disease that we have a lot of outbreaks in the country. So therefore, having opportunity to get the measles, it will now protect our children from having measles outbreak in our societies. And at the same time also, it will protect our children from having rubella, which is the mild form of measles. And at the same time also, it will protect our future mothers from having transferring that deadly virus to their unborn children. That is with coming with children with this congenital rubella syndrome. So those are some of the potential that it will have. And generally, if you look at it, if you can work backward, at the same time, it will now improve the performance of our children. It will ensure that the children goes to school and they are also very, very productive. It is only a healthy child that will be a protective and also productive child. So all our health facilities that are offering routine immunization in the state that are currently implementing the vaccine is available, and our people in the community can really go there and assess the vaccine. Then the second location, we have what we refer to as the community outreaches. So it is also going to be in the community. So we have teams that will be providing it at the FIS facilities, and we have also temporary FIS facilities which will be in the community in some strategic location that will be agreed between the community and the healthcare workers. And at the same time, it will be in like marketplaces, it will be in front of some strategic location like the My Angua's houses, and also maybe some areas like school. So school is one of the areas that we are targeting, because if you look at the age group that we are targeting between the age of 9 to 14, so you will find them in the school, especially those that are within the age group. So all our school, primary school, as well as especially the junior secondary schools, those vaccines, they will be available.
But that will be with the consent of the
Exactly. Yes, definitely. We have devised already a strategy. What we usually do, like ahead of the campaign, we also send a kind of team and working with the state actually and the local government to ensure that they send communication to all the schools. So we already have sent communication 2 weeks to the time to all the school, and the school are expected also to communicate to the parent. So we are working as a one strong team to ensure that at least we achieve this target.
I know I was spoken about this earlier, but the federal government recently launched the Africa's largest integrated health campaign, targeting over 1,000 million children. Now, how realistic is this, and what's the strategy behind it?
So the idea around targeting these numbers is actually to ensure that we develop what we refer to as a population immunity or herd immunity. And the herd immunity will be able to ensure that those that receive the vaccination are protected. And at the same time, because of the population immunity, even those that miss the vaccination will have some level of protection, meaning that the virus will be limited in the circulation because of the coverage that we are able to have. So this is actually what we are targeting, and we are also forced to ensure that we achieve this target. We are looking at nothing less than like 95% of our targeted population. That is through our post-campaign coverage survey.
So that's achievable?
Yes, definitely is an achievable. We have done it before. Okay. In the last campaign that we did, we were able to surpass our target. And this time around, to definitely going to achieve it with all the stakeholders that are on ground. Thank you.
Okay, beautiful. Now, finally, what is the most common misconception you have come across about vaccines, and how would you like to set the record straight?
Yeah, thank you very much. The most common misconception is like, one, vaccine doesn't work, vaccine kills, vaccine also cause what we call like infertility, and all those ones, they are misconception. So I want to set the record straight. We all vaccinated our kids, And all those that were vaccinated are also, they have their children. We never recorded those kind of misconceptions are not really true, and we are calling all our community that they should really get the right people to get the correct information, and the right place to go is actually to go to the health facility and get the right people to get the information.
Okay, Dr. Bello, thank you very much for sharing your insight and joining us on Health Options.
Thank you very much, and thanks for having me.
Okay.
Bye.
Now here is our little moment to breathe, learn, and reconnect with the beauty of nature. Let's see what we've got for you this week on our Nature's Corner. Don't go away.
Malaria is a life-threatening disease in human beings, and it's usually caused by some strains of Plasmodium. There are 5 of them, but more importantly, in the tropics, where it is very, very prevalent, there are 2 types, P. falciparum and P. vivax. They are the very virulent type that are found in the tropics, where they dominate and cause malaria. In the mild situation, it says the patient exhibits the following: fever, chills, and headache. But in very, very serious situations, fatigue, seizure, confusion, and then life-threatening breathing difficulties. And the people that are usually at the receiving end, or that are easily affected by this malaria, are the infants, the under 5, pregnant women, those who are infected with HIV/AIDS, and then some travelers. I have done a presentation with grape, and I use this one to show, since it resembles, it can be grape, it can be orange, so I can use it in as any one of them. Orange, in my earlier presentation, I've told you how powerful oranges are, both their back and their ring, because of the phytochemicals they contain, including specifically vitamin C, which they contain as much as 100 milligrams, and that is a very good strength. If it's well concentrated, it becomes like an antibiotics, and it boosts the immune system, and that will go a long way. If your immune system is up, certain diseases or illnesses coming to attack you will not be able to do so because of your heightened immune system. So on that basis, grape red, grape white, and then orange, it will give you a very good combo, driving away malaria from your system. So this is agbalumo seed. I'm sure before now, a lot of you may not know African star cherry. This is the seed, but we need to call it agbalumo because most of you know it as agbalumo. So this is very, very powerful in suppressing malaria, even at the curative level. You make this into powder, and then you can take it as tea for the purpose of treating malaria. And it has also got immune boosting properties. The African cherry is a very, very powerful one. We also make use of the root in immune boosting, and in also malaria, the back of the tree, the same African cherry. So they are quite very, very powerful. So your popular cocoa, the cocoa you know, is very, very good. It has a lot of polyphenol. It has a lot of anti-malaria properties. And the onions, they have about 5 different types. The yellow onion, the spring onion, the black onion, the purple onion, the red onion, the white onion. There is a combination of all of them I do. It throws malaria away on the spot. It's very, very effective. Even in measles, strong antibiotics. Your common kitchen item you look at anyhow is very, very strong. It boosts the immune system of the human system, and it prevents a lot of sicknesses, including measles.
And that's where we wrap it up this week's edition of Health Options. Remember, prevention will always be better than cure. Protect your child, protect your family. Get vaccinated. To rewatch these or past episodes, don't forget to like, share, and subscribe to our YouTube channel at NTA Networks. Thanks for watching. I am Salwa Khalil Ibrahim. See you next time.